For both those living with ALS and their caregivers, some of the greatest concerns and anxieties come from asking, how am I going to help my loved one when they can't do X, Y, Z? When their hands get weak and they can't care for themselves, when their legs get weak and they can't move around as well. This segment is dedicated to helping you learn about the tools and techniques and things that you can do to make it easier for both you and your loved one. Very often, early in the disease, people with ALS have hand weakness that affects their ability to eat and drink. Given that staying well-nourished and well-hydrated is so important for someone with ALS, we want to address those concerns quickly. As far as utensils, there are utensils with larger handles built into them, or an easy fix is to buy a piece of tubing, cut it into segments, and put the tubing over the handle of the knife and fork to make it easier to grip. Drinking fluids can become very challenging if there is weakness in the arm muscles required to bring a cup to the mouth, or in the hand to hold a cup. Something that we don't consider is the weight of a cup or a glass. With normal strength, it's not even an issue, but when there is weakness in the arm or the hand, the weight of that cup or glass becomes very significant. Using things like lightweight plastic cups or smaller cups can be very helpful, or cups with handles. Many people find using a long straw helpful so that they don't even have to lift the cup to their mouth. For eating food on a plate, something to consider is the temperature of the food. We want to encourage people with ALS to eat as much as possible, and we want them to enjoy their food. If it takes a long time to eat food on a plate, it can cool and become less appetizing. Many people find it helpful to use a plate warmer to keep that food warm and appetizing throughout the meal. Another thing that you can use is a plate guard, so that the person with ALS can feed themselves with one hand by pushing the food against the side of the plate without having to use a knife or other utensil to get the food onto the fork or spoon. There is something called an OB robotic feeding arm, which is a device that is attached to the table and programmed so that someone with no arm strength can use it to feed themselves independently without being fed by a caregiver. For both caregivers and people with ALS, another great concern is mobility. As leg strength is impacted, the ability for the person with ALS to navigate their surroundings safely is a great concern. We want to prevent falls wherever possible. And in fact, I like to tell people, if you're falling a lot, you're walking too much. Frequent falls are a sign that it's time to move to a different type of adaptive aid, sometimes a walker, sometimes a wheelchair, and your physical therapist will guide you as far as these tools. Adapting to these tools is emotional for both the caregiver and the person living with ALS, because every new piece of equipment represents an advancement of the disease. Home modifications are very often needed so that the person with ALS can navigate safely with a walker or a wheelchair. This includes ramps, sometimes stair lifts, or modifications to the setup in the bathroom. Contact your care services coordinator for more information about where to get this equipment and what is needed. When a person is no longer able to move themselves from one sitting surface to another, they need help. We call that transfers. And the way that you as a caregiver help your loved one will evolve as their strength and disease progress. The first step is that they just need help getting to a standing position. In that case, we use a gait belt wrapped around them with handles so that you're not grabbing onto clothing to help them to a standing position. As their ability to stand changes, you may need something called a Hoyer lift. It has a large base and has a crane with a sling that you put under your loved one to safely move them from surface to surface. When someone with ALS is in a bed and they're unable to move themselves around because they don't have the arm or leg strength or even trunk control to wiggle around, a very helpful tool is what we call a transfer sheet, which is nothing fancier than a flat sheet folded into quarters and positioned under the person with ALS. Then it can be used as a lift sheet to help them adjust position in bed. Your occupational therapist and your physical therapist will be very helpful in adapting the plan for your loved one's mobility as the disease progresses. Your loved one will also need more help with all of their personal hygiene tasks, everything from washing their face, brushing their teeth, to bathing and toileting. There is a great loss of independence with this transition, and many of those tasks do fall to the caregiver. There's a balancing act of helping your loved one and helping them to conserve their energy, because something that we really try to teach people is that we want you to save the energy for what is important to you. For some people, it's most important that they have time with their loved ones. For others, it's really important that they be able to take care of themselves independently. This is a moving target and will change as the disease progresses. But talk to your loved one, keep the dialogue going, and help where you can, but allow them to do as much as possible where they can. As far as bathing, falls are the greatest risk for someone with ALS. And in a bathroom, there is no soft place for your head or your hips to land. So we want to avoid falls in the bathroom as much as possible. Things like something to sit on, a tub transfer bench to help you get into the tub, or if you're able to get into the shower on your own, someplace to sit, and again, to conserve energy. Speak with your occupational therapist about specific tools that may help your loved one bathe with more independence. Things like a long-handled sponge, a handheld shower head can be very helpful and allow just that degree of independence, even if they need help getting in and out of the shower. As far as dressing, again, falls are a risk, so we often recommend that people sit down while they are getting dressed and not on the edge of a bed. Comforters are slippery, and it's too easy to fall off the edge of the bed as you're trying to balance to put a shoe on. There are a large number of adaptable clothing options that people can use. Simple things like Velcro closures. There are companies that specialize in making adaptive clothing, and your care services coordinator can help you find those resources. Grooming is also very personal and important to someone with ALS. For males, they may need help with shaving, which may be easier for some with an electric razor, but because of the big grip, but some people may not be able to hold the weight of an electric shaver and may do better with a safety razor, maybe with the handle built up. Again, adjust your plan according to your loved one's needs. Energy conservation is the name of the game here. We want to honor independence, but we also want your loved one with ALS to have enough energy to spend the day doing things that mean a lot to them. But for some people, bathing independently means a lot to them. So honor that boundary and arrange for a nap before they launch into other activities. Like everything as being a caregiver, this is a balancing act and a changing target. Oral care is critically important for someone living with ALS. It's not just a matter of pleasant smelling breath and clean teeth. It's really a matter of helping to prevent pneumonia. What many people don't understand is that pneumonia isn't just caused by food or fluid getting into the lungs. It's the bacteria from the mouth that it carries with it that causes the pneumonia that can be life-threatening for someone with ALS. So we very often stress meticulous oral care, and cleaning the mouth at least twice a day is very important, even for those who are not taking food or fluid by mouth. For those who want to brush their own teeth, an electric toothbrush can be very helpful, although for some, it may be too heavy, so you have to look for a model that has a lightweight handle. For those who have a lot of secretions, using some sort of suction tool can be very helpful. This can be a separate suction container, kind of like what is at the dentist's office, or there are toothbrush attachments that can be connected to those suction toothbrushes. In later stages where the patient is maybe bedbound. Using mouth swabs to clean the mouth is very important and should be done twice a day, again, even if the patient isn't eating or drinking. Dry mouth is a risk factor for an oral fungal infection called thrush that's very painful, and we want to avoid that wherever possible. It seems counterintuitive for someone who has difficulty with secretions and maybe drooling that we're worried about dry mouth, but the fact is that the roof of the mouth and the back of the throat can still be very dry because the person is breathing through their mouth. So it's important to keep the top of the mouth nice and moisturized, even in the case where someone has a lot of secretions. There are sprays and gels that your team can guide you to that are available through the grocery store to help with this. Another consideration is dentures. For people who have dentures or any fitted oral appliance, as they lose weight, the face shape and structure may change and they may no longer fit. If the patient is able to go to the dentist for an adjustment, that may be an option, but for many, just going without that appliance may be the solution. The skin is the largest organ of the body. Its function is to protect and guard against infection and protect the tissue that is underneath the skin. In ALS, the skin is very vulnerable because of a combination of mobility and the inability to shift position and nutrition. The risk of pressure wounds is significant and can cause systemic infection and pain. We want to avoid them wherever possible. When assessing your loved one's skin, look for redness, swelling, or even patches of dryness that can be a sign that there's too much friction from clothing, from a surface. We want to alleviate that as soon as possible. Frequent position changes are very important. For someone in a wheelchair, using those tilt and recline functions to ease the pressure on a tailbone, elevate the legs, moving and adjusting position frequently is very, very important. For someone in a bed, frequent turning, we try to do it every 2 hours, with supportive pillows to maintain good alignment is important. As far as skin care, we want the skin to stay moisturized and not dry. So use a mild soap to avoid irritation, use moisturizers regularly, and avoid using any sort of powders. Toileting is very personal. And as ALS progresses, your loved one will need more help meeting their toileting needs. This is a challenging task where you balance your loved one's dignity and their need for good hygiene. There are a lot of aids and equipment that can help you both. When someone is still able to stand but maybe has difficulty standing up from a sitting position, things like an elevated toilet seat or a commode or safety frame gives them something to push off of that isn't the sink or the toilet paper holder, which isn't going to support their weight. As weakness progresses and maybe getting up to the commode is more difficult, there are some other options. For males, using a urinal can be an easy solution. And there are also external condom catheters that can be attached to a tube and to a bed at the side of the bed, which can be really useful for overnight use. Female anatomy does not allow for such easy adaptation, but there is something called a pure wick, which is a wick, a cotton wick that is placed between the legs and attached to a suction container that can be very helpful for women overnight to eliminate the need to get out of bed to use the toilet. Adult diapers are a reality for most people living with ALS at some stage in their disease, usually much later. As a caregiver, it'll be important for you to make sure that they are changed regularly and kept dry, and that you're assessing the skin for breakdown. The combination of moisture and friction from the diaper are a perfect breeding ground for pressure wounds, and we want to prevent that. Constipation is a very common problem for those living with ALS. There are many causes, from decreased fluid intake, low fiber intake because high fiber foods are more difficult to chew and swallow, to difficulty getting to the toilet or commode, to bearing down when they get there. We want to address constipation when it happens because it can potentially become very serious and lead to bowel obstruction. Prevention includes making sure that your loved one has adequate hydration, whether it's drinking fluids or through a feeding tube. Also, adequate fiber in their diet, again, either in their formula or in what they are eating. Talk to your nutritionist about some creative ways to get easy to digest and eat fiber into their diet. Prune juice is an old standard, but a very effective one, especially if you warm it up a little bit. And maintaining a regular toileting schedule is very important for your loved one. Things like a squatty potty can also be helpful for those sitting on a commode or toilet to elevate the legs and compress the abdomen and facilitate emptying. Some people find it helpful to have a little bit of abdominal massage to move things around as well. Spasticity is something that we see commonly in people with ALS and can be very uncomfortable. It's kind of like a muscle cramp, but it's a muscle cramp that doesn't release. The muscles are stiff even at rest, and it can become very uncomfortable. It impacts the person's ability to care for themselves, to move around, and it very significantly affects sleep. To address spasticity, it's important to talk to your medical team. There are medications that can help, but there are also some significant things that you as a caregiver can do to help keep your loved one comfortable. Daily range of motion and stretching exercises are the most important tool for alleviating spasticity. Your physical therapist will give you a routine, and these exercises should be done daily and are the most effective way to address spasticity. There are support devices and positioning that your team can guide you through as well. The risk of not addressing spasticity is muscle contractures, where the muscle and tendon stay shortened and the limb can no longer move, and it becomes very painful. Skin can also break down when a limb isn't moving effectively and appropriately. Something we often see in people with ALS is swelling. You'll hear the clinical term edema from some of your providers. This is swelling of the tissues, often seen in the feet or the hands, and it's caused by muscle inactivity. Throughout our day when you don't have ALS, your muscles are contracting and your fluid circulates through your body. When a limb is affected by ALS and not moving as much, it can become swollen. We try to prevent this kind of swelling by keeping the limbs elevated. For legs, make sure that your loved one is using the elevating leg rests on their wheelchair. For arms, keep the arms positioned on the armrests of a wheelchair or balanced on a pillow on their lap if they're sitting. Monitor for this swelling. If it gets worse, be sure to call your doctor. While we're talking about swelling, let's talk about blood clots a little bit. You may have heard the phrase DVT or deep vein thrombosis. That's a blood clot in one of the deeper vessels in an arm or a leg that causes swelling. So when we see swelling, we want to distinguish the difference between dependent edema from a lower limb or a deep vein thrombosis, a clot, which can be life-threatening. If you see swelling only on one side and it is warm and tender and there's pain associated with it, that's a red flag that this may be a blood clot and you should contact the doctor's office immediately. As ALS progresses, your role as a caregiver increases. There's no two ways about that. Your role is to support your loved one as their ability to take care of themselves decreases. This is a moving target and will require a lot of communication between you and your loved one. Acknowledge that this is hard. Accept gratitude when it's offered, but acknowledge that it's not the life that either of you signed up for. As a caregiver, you will also very likely start to assume responsibility not just for personal care, but for doctor's appointments, scheduling, medication schedules, things that your loved one used to be perfectly independent about. Again, it's a balancing act where you preserve autonomy where you can, but also preserve your sanity and ask for help when you need it. Stay in touch with your care team and ask questions. Share your frustrations and concerns over your loved one's changing status so that they can help you. When your team makes recommendations for equipment and tools, take them up on those offers. They recommend tools sometimes before they're actually needed so that you have them on hand when changes occur. One of my favorite phrases is, "You can do anything, but you can't do everything." Your role as a caregiver for someone with ALS will be constantly changing as their disease changes. The goal is to support them with dignity and preparedness. Being educated about the changes that may occur and anticipating them where you can is very helpful in equipping you to address those changes. Being flexible is very important and not always easy. As a caregiver, you will not only assist with personal care, you will also be required to step in and help handle things like appointments, medications, things that your loved one was previously independent in and able to take care of by themselves. The nitty-gritty daily caregiving for someone with ALS can be daunting. You're not going to get it right every time. You're not going to always get it right the first time. It will take practice and adjusting, and lots of conversation between you and your loved one. That's part of it. But with the right tools, the right information, we are confident that you can take care of your loved one and help them meet all of their needs to keep them comfortable and help them live well with ALS.